Hi, I'm Dr Dee Ripley and I'm the Deputy Chief Scientific Advisor for Health in Welsh Government, and I'm delighted to introduce the shortlisted projects for the award of New Ways of Working. The shortlisted projects are Paediatric MRI Scanning, a New Approach from Cwmtaf Morgannwg Health Board, Gwent Community Psychology from Aneurin Bevan University Health Board, and Waiting in Pain, an innovative rapid access palliative radiotherapy pathway from Velindre University NHS Trust. Let's hear more about them.
Hi, I'm Karen John, one of the senior MRI radiographers at the Princess of Wales Hospital in Bridgend, and I'd like to present to you our project, Bedtime Magnetic Resonance Imaging, a New Approach. We identified that the waiting times for our paediatric general anaesthetic assisted MRI was 18 months, the impact of this being delayed diagnosis and treatment. A new way of working was suggested by our paediatric radiologist, that of bedtime scanning. This technique involves adapting our MRI department into a child-friendly environment by means of dimmed lighting, starlight projector and decorations. We offer appointment times similar to that of the child's normal bedtime, and we encourage the children to attend in their pyjamas. We then attempt to scan these children whilst asleep. After initial success, bedtime scanning was implemented, and we now offer one bedtime session per month, effectively doubling our paediatric throughput. We are the first hospital in Wales to provide this service, and our aim is to continue inspiring others to work in this new way. Thank you for listening.
I'm Dr Rhiannon Cobner, a consultant clinical psychologist and lead for child and family community psychology in Gwent. We're a team of clinical psychologists, systemic therapists and assistants located within ABUHB, but working in partnership across a range of different sectors, including health, social care, education, housing, police, youth services and sport and leisure. We believe in supporting the everyday relationships children and young people have with those in their family and community. We want to raise awareness of what children need to thrive psychologically and to create a culture where adults can respond to distress, holding on rather than referring on. We do this through consultation, group work, supervision, direct training, and gathering sound evidence of our effectiveness through our quantitative and qualitative outcome measures. Moving forward, we hope to be able to produce guidelines as to how this new way of working can be operationalised nationally.
It is a new approach to palliative radiotherapy. We do a lot of palliative radiotherapy, but this is a new way of doing it, looking at a multi-professional team delivering that palliative radiotherapy, mainly through a clinic, but also supporting emergency on-call teams at Velindre and other hospitals.
So far, we have upskilled 5 radiographers across Wales, 3 of which are new palliative radiotherapy trainees, while improving the training of medical junior trainees as well. From May 2020, we have seen over 250 patients.
I've sensed that there's actually more demand there than we are meeting at the moment. Almost from the offset, the clinics have been full. I think we can see this developing in the future into more of a service.
I was amazed how quickly they were able to activate my treatment and to have me in to administer it.
Bore da bawb, hoffwn i ddiolch I Bwyllgor Gweithwyr Proffesiynol Perthynol, I Iechyd a Phwyllgor Gwyddol Gofal Iechyd Cymru am y gwahoddiad I ymuno gyda chi heddiw am eich cynhadledd genedlaethol 2021. Mae'n bleser I siarad gyda chi fel cymuned aml broffesiynol o bob cwr o'r gwasanaeth iechyd a gofal cymdeithasol. Mae'n dda I weld bod pob un wedi ymrwymo I sicrhau ein bod yn darparu gofal o'r ansawdd uchaf posibl i'n poblogaeth.
It's an honour to accept this award on behalf of Child and Family Community Psychology in Gwent. We believe with a passion that communities, however defined, have an enormously important role to play in the healthy psychological development of our children. And it's a privilege to be given this opportunity to develop new ways of working, taking psychological ideas out of the clinic and across and into our communities. Thank you to Advancing Healthcare Awards Wales for this opportunity to showcase